Have you ever been in a doctor's office and they start Googling and you're like, am I in danger? Do they know what they're doing? Now, here's the thing. If your doctor is never looking anything up for you, it's actually a red flag. Medicine changes year by year, month by month, day by day. Things that I learned in medical school are completely outdated by now. It's completely disingenuous for any doctor to pretend that they are completely up to date on every single illness at any given moment. When we're looking something up, we're not Googling like you Google a recipe. We're looking up for the latest evidence. We're looking at databases like PubMed for the latest literature. We're looking at expert consensus opinions. We're looking at clinical practice guidelines, information that is not available to the general public. For example, if you have a male GP, doesn't do a lot of women's health, but a woman presents wanting to discuss menopause, PCOS or PMS, there's a few decisions to make there. Number one, do they wing it and guess it? Is that what you'd like your doctor to do? Number two, do they just fob you off because they're not sure, they don't know what to do, so they just will fob you off and hope you forget about it? Or number three, do they say it to you? They say, look, I don't deal with this a lot, but let's look up the latest evidence and latest guidelines on this and let's work through this together. One of the most important skills you learn really during your intern year is knowing the importance of saying when you're out of your depth and saying, I don't know, I need to stop, I have to stop, because you can't guess. So you have to say, wait a minute, I have to look something up. I once spoke to a colleague about this and they said that they send patients to the bathroom to pretend that they need a urine sample so that they can look something up without the patient knowing. But I have a really different approach. I tell the patient exactly what I'm doing. I tell them the exact resource that I'm reading from. I print it out often and give it to them to empower the patient. And really doing that is actually the harder thing to do because it takes extra time and there's people waiting in the waiting room, but it's going above and beyond for the patient to make sure that you're doing the best in line with latest evidence and latest clinical practice guidelines to get the best result and best outcome you possibly can for your patient. Have you ever had a doctor look something up in front of you and it's put the fear of God into you? And have I convinced you that it's actually a good thing?